Hello everyone, in today's video I am sharing another technique that is used to facilitate elbow extension movements and also break the spasticity around the scapular area and the shoulder area. You may often see in some patient when they come in standing or try to walk, their hand come anterior to their chest in like this fashion. Because of tightness structure of scapula and hypertonicity around the scapular muscle. To prevent this complication, you have to train this exercise before starting with the active rehabilitation of upper limb exercise. So let's start with a practical demonstration. Patient is in the standing position, hand placed on the table in front of him, fingers are extended, elbow is extended too. Now let's say this is the patient of right side hemiplegia. So we stabilize the patient from here, and now while stabilizing in this manner, ask the patient to hold this position and try to extend his elbow, actively extend. Once the therapist feels the hypertonicity or spasticity is reduced around the upper limb in extension manner, now the patient is asked to do pelvis shifting. While the patient is shifting his pelvis, the therapist stabilizes the elbow. First thing is this. Now the patient is further asked to rotate his trunk in this manner while stabilizing the wrist, shoulder and elbow in this manner. Once the activity is performed, now patient is asked to step backward and forward with the sound leg or the normal leg. So take a step back from the normal leg and come forward. Take a step back with the normal leg and come forward. Take a step back with the normal leg and forward. This may facilitate the weight bearing on the upper limb as well as the lower limbs. Now, once the therapist trains this exercise to the patient and feels that there is no hypertonicity in the upper limb region by doing this exercise, now patient can be asked to flex the trunk in this manner while stabilizing the elbow in this manner and putting pressure to the table and extend the spine and doing this activity and extend. So when patient is doing flexion and extension of trunk, it will facilitate scapular protraction and scapular retraction movement, and simultaneously patient is also putting force, pushing the table in downward manner. Now another thing what we have to facilitate in this exercise, that by doing this exercise you may inhibit the tightness in the upper limb as well as the trunk area. When patient is doing this exercise actively and therapist feel that there is no tension increased by doing this activity, now the patient hands and shoulder are furthermore external rotate and forearm in the supination. This is the advanced stage of the exercise. Now the shoulder is in the external rotation and the elbow is in the flexion, elbow is in the extension and forearm is in the supination. Now ask the patient to perform that same activities like trunk shifting while maintaining this position of elbow and forearm, trunk flexion, extension and flexion and extension, and step backward and forward while maintaining the elbow in the extension, forearm in the supination, shoulder in the lateral or external rotation. So by doing this maneuver, you may facilitate elbow extension movement in closed kinematic chain position, because closed kinematic chain exercise provides stability to the joints and the muscles. So before starting with the functional active rehabilitation of upper limb, start with this exercise to facilitate elbow extension movement. And yes, spasticity around the scapula and elbow is also decreased, because on a stable distal surface the proximal parts are moving. So moving trunk, shoulder upon the fixed wrist and elbow is decreasing the spasticity of whole the upper limb, and maintaining this position will induce the stability in the elbow extensors as well as in the shoulder depressors movement, shoulder depressant muscles. So try this technique and let us know your valuable feedback in our comment section. Till then, stay connected and thank you.